Well, hello, everyone, and welcome to the Tenpenny Files. I'm your host, Dr. Sherri Tenpenny. The Tenpenny Files has daily conversations meant to inform and educate. We're not here to just entertain. If it matters to your body, your freedom, your future, we talk about it here. Each day, I have conversations with authors, documentary filmmakers, and independent thinkers whose work challenges mainstream messaging. We cover a wide range of topics, so there's always something here for everyone. We talk about government, history, astronomy, food, farming and fitness, vaccines, health and health policy. And once a week, we talk to authors or pastors who write about faith and biblical principles. My goal is to introduce you to topics you've never heard of before or topics you always wanted to explore but didn't know where to begin. Let our guests here at the Tenpenny Files show you the way. Join me here every day, Monday through Friday at 3 p.m. Eastern on the Tenpenny Files, where we hear from voices who've often been ignored, silenced, or censored, but truly have something important to say. So I want to begin by inviting all of you to join me as a Tenpenny Prime member. We have a lot of opportunities there and a lot of things that we are growing the membership all the time. So go to primemembership.drtenpenny.com, primemembership.drtenpenny.com to learn more. Hopefully join us and support our work. And one last thing, I want to say thank you so much to our growing audience. The number of people who are joining us here every day, and I'm grateful for people who've been following us all along. I'm certainly appreciative for all of our listeners. Now, let's get started with today's guest. Today's conversation is with the president and medical director of an internationally renowned Oasis of Hope Hospital, Dr. Francisco Contreras, one of the world's leading voices in integrative oncology with more than 40 years of experience treating cancer patients from 50 countries around the world. He's here to talk about his new book, The Art and Science of Undermining Cancer, a resource guide that leverages metabolic traits against cancerous cells. And then we're going to talk about his cancer center in Tijuana, Mexico, the Oasis of Hope. Dr. Contreras, welcome to the Tenpenny Files. Thank you so much for joining me here today.
Well, it's a pleasure and an honor. Thank you for inviting me.
Your father founded the Oasis of Hope more than 60 years ago. How has the hospital evolved since his original vision, and have things basically remained the same?
Well, it has evolved tremendously, but the philosophy on how we develop therapies and how we administer therapies has not changed at all. And it's based on two principles. The first principle was stated by Hippocrates, the father of medicine: first, do no harm. And we interpret that as whatever we're going to do to the patient is aimed at improving the quality of life of a patient. The second principle is what Jesus said: love your patient as you love yourself. And we interpret that as we are never going to do anything to a patient that we wouldn't do to ourselves or a very loved one. So, based on these two principles, everything that we apply to the patients is not going to change. Obviously, the technologies, as my father passed, and research has progressed significantly, so that our therapies have changed, but not our principles.
That's great to hear. Your medical training it took you from Mexico to Austria, where you learned German principles in German New Medicine to complete your studies. How did these international experiences shape your approach to cancer care?
Significantly, one of the things that happened to me when I was studying medicine is that my aim was to work with my father. My father was an oncologist and a pathologist, and he did not wanted me to come into the practice of alternative medicine without having all of the basis of conventional training. So I had, all of my conventional training, always with the aim of working with my dad, because I was convinced that his principles were the ones that I wanted to follow. But I learned, especially in Austria and the whole of Europe at that time in the 70s, was not the same as in America. In America, the focus was basically on how to destroy the tumor, whereas in Europe was more how to work with the patient to improve the possibilities of this patient surviving cancer. And that was more aligned with my father's way of treating cancer patients. So it helped me tremendously to come back and work with my father shoulder to shoulder in helping cancer patients fight their disease.
You know, your father was spot on right. My first career was in emergency medicine, and I was an ER doc for 12 years and director of a level two trauma center. Then I opened an integrative center here in Cleveland and have over the years had a lot of students that rotated through our clinic. And I think they thought it was going to be just an easy, one-off, that they'd learn a little bit about vitamins and that would be all they'd have to do. And we were constantly drilling them on anatomy and physiology and biochemistry and saying, listen, you're closer to this academically than we are. You should know these things. And in order to do integrative medicine, you have to be a good conventional doctor first because you have to
Correct.
be able to evaluate and really diagnose patients. And then you just have a different toolbox that treat people from, but the diagnostics are the same. So
Correct.
say that to all of our students and the people who are listening to this, that if you are seeing an integrative oncologist or an integrator or functional medicine doctor, they've been trained in conventional medicine first, so that they should be a good diagnostician. And then they just have a bigger toolbox to work with, than
Correct.
they are. You've seen patients from all over, cancer patients from all over the world. Do you see or have you seen any particular patterns to what you see from different countries, or are the underlying causes kind of ubiquitous and sort of the same everywhere?
Unfortunately, the school of thought from America is so heavy on every other country that usually our countries, um, when Americans say jump, we don't ask why, but only how high. Uh, and so we have to swim against the current in trying to convey our message that there's a different way of thinking about diseases and how to help patients when you focus on the patient more than when you focus on the disease. So the patterns of treatment of patients virtually all over the world, whether it's a first world country or a third world country like ours, they're basically the same. The only thing that happens is that in third world countries, we don't have the resources to spend on therapies that are extremely expensive, but visually of no value to the patients. So most of the patients, no matter where they come from, come after having had very poor experiences with chemotherapy, radiation therapy, or massive surgery. So that pattern continues to be the same, unfortunately.
And do you see that from if patients come from Europe or from South America also?
Yes, unfortunately. Even well, what happened when I was in Europe, Europe was independent, but with the EU, they acquired all of the regulations from the FDA and just copy pasted them to their system, and so it's virtually the same. Germany used to be extremely open to alternatives. In fact, many of the alternatives that we continue to use here were from German researchers, but nowadays, the research is basically the same as here in America since
Oh,
the EU was stated.
that's really sad. I remember there was a Dr. Rao years ago that he had a center, I believe it was in Switzerland, maybe in southern Germany, close to the Swiss border. And he used to come to America and teach classes on different ways to look at things like pleomorphism and dark field microscopy and
Yes,
types of homeopathy. And they don't do that so much anymore now.
that has changed dramatically in the last 3 decades.
Oh,
Dramatically.
wow. That's really sad to hear. You know,
Yes, it's
um,
very unfortunate.
And you're located in Mexico, so you're in Tijuana. And I spent some time down there. Told you before we started the recording,
Yes.
I was at Sonovive Medical Institute. I think it was 2008 to maybe 10, somewhere around that way for like a couple of years. And it was always so that was almost 20 years ago. And the thought was that the centers had been set, there's quite a few of those types of centers had been set up in Mexico because the Mexican government was more lenient or more inclined to allow those sort of centers to exist and treatments to be there. Is that still the case in Mexico?
Yes, one of the reasons for that is that the Mexican government is very aware of the limitations of our countrymen in the sense that it's very poor. So more than half of our population lives under the line of poverty, and so the Mexican government is a lot more open to natural and home remedies because otherwise many people don't have any access to it. That's one of them, and the other one is that the Mexican government also is very open to immunotherapy in comparison to America. For instance, all the development of the new immunotherapies come from America. So the dendritic cell vaccine, quote unquote, because it's not really a vaccine, that's the way that it was named by the inventors, all come from America, and they have been approved in Mexico, almost 2.5 decades ago. And in America, they continue to do clinical trials, and it's not open. And so what happens is that they're stuck in all of this safety issues that the FDA required. And the Mexican government said, well, if it's a product that is derived from the patient's own blood, and it's only going to be administered to that patient particularly and not to anybody else, why should you do safety tests? And so we're able to develop all of those therapies here in Mexico that have been designed in America, and patients have to come to Mexico to do them here. So yes, Mexico is a lot more open to alternatives than many other countries in the world.
You know, your book, The Art and Science of Undermining Cancer, is a delight to read. It's got history in there, and it's got some things about your family, and it's almost like a manual, like people that, a two-part manual. One is something that you can do with your doctor, and the other part that you can do with your on your own. What prompted you to write it in that style, and how did you want people to get this book and use it for their own care?
Well, I've written several books, and the reason for that is that information is extremely powerful. And when you have a quote unquote terminal disease, the decisions that you make will determine the outcome. And nowadays, there's so much information out there that it's really confusing to people, and I wanted to bring information to people in a very easy to understand way. And I talk about all of the possibilities that a patient that was just diagnosed or that has been dealing with cancer for a while can understand what all the options are conventionally and non-conventionally, because as you mentioned, we are integrative. I don't believe that everything that conventional medicine has to offer is wrong. And I don't believe that alternatives have all of the answers. And so our purpose here is to put the puzzle together. And I have pieces of the puzzle from the conventional and from the alternative, depending on the patient's needs. And so my aim first was to bring information in a simplistic way for most of patients to understand what their options are, and then to make an intelligent decision on what is good for them, depending on that information. And the second purpose of my book was to let cancer patients know that cancer is not necessarily a death sentence, that there's many things that people can do to beat it, but also to survive it. What I mean by that is we have many patients that were told, oh, you have, 6 months to live, 12 months to live. And if we give you chemotherapy, you have 2 years, but you're going to lose all your hair. You're going to be vomiting all the time. It's just an awful type of information for the patient that is very gloom and doom. And so we have patients that were told that, and yet they're alive 20 years later. But when we take x-rays, they're not cured. But after a while that they've survived this, they couldn't care less because they're enjoying life. So you don't necessarily have to get rid of every little cancer cell, but a patient can then control the cancer and stabilize him or herself and live for a very long time with excellent quality of life, even if the tumor doesn't go away. So I wanted to know, I wanted the patients to know that there are many options and that, again, cancer is not necessarily a death sentence.
Yeah, and I think you talk about this in your book too, about that from a conventional cancer care mindset, particularly in America, that they only define cancer cure by the elimination of the tumor. That if
Yes.
if they get a CAT scan or an X-ray or whatever diagnostic that they get, if it's still there, then you have to do more, even though it may be walled off, it may be calcified, it may have lost its blood supply, so it's not growing. It's just there, just like what you said. Years ago, and, just I'm saying this for the sake of the audience, is that, years ago, they used to mostly diagnose breast cancer at autopsy. People usually died of something else, and then they did a lot more autopsies 50 years ago than they do now. And they would say, oh, look at that, they had breast cancer. And nowadays it's like you've got to aggressively go after that tumor, and it's not cured until the tumor is gone. But what you're saying, and I agree with you, that if you shrink that tumor, calcify it, if it turns into like a piece of gristle and it's just sitting there and there's no blood supply and it's not doing anything and life can go on, that really is the best way to define a cure. Is that correct? Did I summarize that
That is
correctly?
correct. Because so many times in trying to get rid of the cancer of the last cell, we get rid of the patient as well. And unfortunately, it goes into the books as a success because the cancer died. I mean, the patient died cancer free. And so my position is that I'd rather have live failures than dead successes. And it changes the whole philosophy on how you treat patients. And the patient also will have reduction significantly of the stress of the therapies that are so maiming, that are so destructive. And so once a patient is enjoying life, enjoying quality of life, the patient relaxes to the point that the immune system works better. And so the possibility for them surviving the cancer are much higher. Um, and the other thing that I think is very important is to help patients manage their emotions, because cancer's power is provoking fear. And one of the things that we work tremendously with our patients, and we provide them with emotional and spiritual resources, is in converting them from victims into victors. And that gives them so much power, and the immune system strengthens to the point that many miracles happen just because of that change of attitude. And we're criticized tremendously for quote unquote selling false hope. And my question has always been, well, what is true hope? You're going to die in 3 months? You're going to die in 6 months? Well, that's not true. There's either hope or no hope. And we know scientifically that the mind is very powerful. Why do we do double-blind studies? Because the power of the mind can can change the outcomes, right?
100.
So why don't we exploit the power of the mind in the benefit of the patient? And
100%.
so I unashamedly brainwash my patients to believe that they can beat cancer. And when they believe it, they beat it.
That's very good. When you do this, when you're talking to patients that come to your clinic, um, do you how do you define cancer? Do you think it's a genetic condition or is it a metabolic disease?
That's a very good question, and it determines how you're going to act, right? So the conventional wisdom is that cancer is a genetic disease. And so all of the therapies now developed are based on genes and gene mutations. And so that's the whole thrust behind the development of targeted therapies. So they target specific gene mutations in the production of certain proteins that are going to benefit the cancer. So that if you target that production of protein and then that protein is not produced, the cancer is going to suffer. It makes sense. And cancer is a genetic disease. But the little problem is that most cancers have many, many mutations. So on average, a breast cancer patient has about 100 mutations.
Wow.
Colon cancer have about 180 mutations, and so on and so forth. So to cure cancer, you would need 100 targeted therapies. And not only we do not have them, they're extremely expensive. Every targeted therapy on average is about $10,000 every 3 weeks. So imagine if, let's say that we had the 100 targeted therapies for a breast cancer patient, and not every cancer patient of the breast has the same mutations, okay? So it gets very complicated. Well, the cost of the therapy would be about $1 million every 3 weeks. Not even Americans would have that capability. So yes, cancer is a genetic disease, but it has a tremendous impact on the metabolic entity of cancer. And the metabolic variations are very limited in comparison to the genetic variations. So, for instance, all cancers, cancer of the breast, cancer of the colon, cancer of the brain, it doesn't matter. All cancers need a lot more sugar to survive than normal cells. And doctors will say, well, diet doesn't play a role in everything. And then they prescribe a PET scan. For your audience, if you don't know what a PET scan is a very sophisticated type of X-ray where the contrast material is sugar. And this sugar is tagged with a radioactive material. Why is it sugar? Because the tumors need to consume a lot more sugar. They uptake the sugar and the tumors light up. So we know that sugar plays a role. So logic would say, well, then let's restrict the amount of sugar that a patient is taking. And that's a metabolic thing. Because of this metabolism of cancer, tumor tissue, the tumors themselves, the environment of the tumor is acidic. So it doesn't matter which tumor you have, it's acidic. Not your body, the tumor. And there are ways to impact the acidity of tumor tissue. So now we have another tool to act against the cancer. All cancers are hypoxic. The tumor tissue fend themselves very well from oxygen. And we know that tumor tissue can change the concentration of oxygen when you administer ozone. And tumors hate oxygen, but ozone can provide oxygen. All tumors live in what is called oxidative stress. And it's virtually impossible to antioxidate them, but it is very possible to oxidating them even more. So oxidative stress, and that's the way radiation works, for instance. It kills tumors by oxidative stress. So all of these metabolic traits are common to all of the cancers, and you can exploit that to kill them. And so we have this very strong metabolic therapies that addresses these common denominating factors, and we have been very successful in treating cancer with non-toxic therapies that have given us very, very good results. Our outcomes are much better than with conventional therapy, and it's because of this philosophy that we are going to attack cancer not from the angle of its origin, which is genetic, but from its impact, which is metabolic. So again, these are a very limited number of metabolic traits that all tumors have, and that we can very successfully administer to our patients in a way that it's not toxic to them.
Wow, that's exactly what cancer patients want to hear. And I hope a lot of people that are listening to this will, if you have cancer, take this in seriously. And if you know someone in your life that has cancer, share this information. There's more to come. Right now, we're going to take a short break to hear from our sponsors. Dr. Contreras, I've got so many more questions to ask you, so I hope we don't run out of time because I have a lot of questions to ask you. But right now, we're going to take a quick break. We need to hear from our sponsors that sponsor AmericaOutloud.news. The Tenpenny Files is heard on the iHeartRadio network every day, Monday through Friday at 3 p.m. Eastern. You can also listen anywhere in the world by going to the media player at AmericaOutloud.news. And if you've missed any of these great conversations, and they have been just marvelous, you can find the Tenpenny Files if you put the Tenpenny Files into your favorite podcast platforms such as Spotify, Pandora, Apple, iTunes, TuneIn, iHeart Virtual Studios, on my platforms, which are X, Instagram, Rumble, and we've started a YouTube channel. So everything is out there on YouTube too. I think the best way is to go to drtenpenny.com, hover over the podcast tab and scroll down. You'll see a line that says all podcasts. You can find them all in one place, all right there, that you can either listen and or watch. We've got more to come. We've been having a great conversation with Dr. Francisco Contreras from the Oasis of Hope, also talking about his book, The Art and Science of Undermining Cancer. Listen to these sponsors closely. If it resonates with you, please buy from our sponsors. It supports what we do, supports the station. We will be right back with more. Zeolite is a detox spray. We work specifically with a company called Touchstone Essentials. They are an incredible company. We've been working with them now for several years. And zeolite is a mineral that goes through your body like a one-way basket. It will clean out heavy metals such as arsenic and mercury, aluminum, cadmium, and it hooks onto those metals from a one-way perspective. So once it's bound, it goes out through your urine or your stools and doesn't get redeposited in other places. Everybody needs to have a detox product in their life, and this one is so easy to use, and it's so safe. You can take it when you're pregnant, you can take it when you're nursing, you can give it to little children, you can even give it to infants, and quite frankly, I give it to my dog. I actually put a little bit of the zeolite in his water because until we all stop living in a toxic world, we all need to get some of those extra toxicities out, the heavy metals, the persistent organic pollutants, the things that are floating through the air, the different things that we come in touch with in our environment. And we are a big fan of zeolite from Touchstone Essentials. We've been a big fan of their products for several years. Go to drtenpenny.com/detox to get your first bottle of zeolite spray for $50 off.
Well, only when the government bows to the people will America become great again. This is Malcolm Out Loud here. Join me in pushing back against censorship, my fellow Americans. Right at the top of AmericaOutloud.news are the words: many voices, one freedom, united in the First Amendment. Now is our time, my fellow Americans. AmericaOutloud.news, liberty and justice for all.
Well, welcome back, everybody. Today's conversation is with Dr. Francisco Contreras, the president of Oasis of Hope and one of the world's leading voices in integrative oncology. We're learning about his new book and also about all the different ways that we can treat cancer non-aggressively without toxic sort of things. And we're reading about his book, The Art and Science of Undermining Cancer, which I think if you know someone that has cancer or you have cancer yourself, this is the book for you. It tells you all about how to undermine the tumor's strength. Let me tell you just a little bit more about today's guest. Dr. Contreras has been around for a long time. He's been treating patients from all over the world for more than 40 years and has solutions for you about cancer. And Dr. Contreras, welcome back to the show today.
Thank you. Thank you, Sherri. Thank you very much.
I want to ask you because right now there's two questions I would ask you. We'll take them two one and then the other one. The first one is this: there's a lot of focus these days about the connection between cancer cells and parasites. What are your thoughts about that?
I think that parasites can definitely contribute to the development or more to the growth of cancer, but I don't think they're the cause. Because if that was true, then the incidence of cancer would be much higher in underdeveloped countries than in developed countries. When I look at Americans, when I think about Americans, I think of them with a Lysol bottle, You're so afraid of bugs in America, and here we live with them all the time. And as I mentioned before, the level of poverty in Mexico is very high. So the problem with parasites in Mexico is extremely high. And yet our incidence is much lower. So I don't believe that parasites are a trigger to cancer or a cause to cancer. I think that any chronic infection, you know, will contribute to the maiming of the immune system. And the worse your immune system, the more you open the door to cancer. But I don't think that they're a major contributing factor.
I listened to a video, I think it was last week or a couple of weeks ago. It was just a short video of a doctor talking about using ivermectin and fenbendazole and membendazole for treating cancer cells. And what he explained on this video made so much sense to me that there's a metabolic process inside of cancer cells, that it's the same metabolic process inside of parasites. And so this drug that messes up or blocks that metabolic pathway in parasites, it's the same pathway in cancer cells. And that's why the ivermectin and the fenbendazole and membendazole really works on the cancer cells, because it's the same metabolic pathway, which made so much more sense to me, because I'm a little bit like you. It's like, well, if parasites were the cause of all these cancers, I would think that third world countries would see a whole lot more cancer than we do. And we're the ones with the most cancer because our diets are awful and we have all these pesticides, and we have all this other stuff. Which brings me to my second question about ever since the COVID jabs, descended upon the world, we're seeing this that is now being called turbo cancers because of how aggressive they are and how fast they are, and particularly in children. Are you seeing more people at your center at Oasis of Hope with turbo cancers in both adults and with children?
Yes, but before we go into that, that makes a lot more sense. And it may be the reason why we have a lower incidence of cancer in Mexico or in underdeveloped countries, because we're always using anti-parasitic drugs on ourselves and our children. At least twice a year, we always, get rid of our parasites. And so that makes more sense. And so there's also, there are some pathways in malignant cells that are exactly the same as with viruses. So that makes sense to me. And so we do recommend our patients, whenever possible, for them to take anti-parasitic drugs. Now, what happened after COVID? I have noticed a tremendous change in the age of our patients. So, for instance, now out of our 20-some patients that we're treating in the hospital, about 17 are below 40 years of age with
Wow.
very aggressive cancers. I mean, when I started this, it was extremely rare to see somebody, under 50. And now, many of our patients are very, very young with very aggressive cancers. And the other thing that I noticed is that we had patients that were doing extremely well. And after the vaccination, their cancers exploded. So I can tell you that I believe that the so-called vaccines, which were not vaccines, were actually drugs. This RNA modifiers have contributed to the aggressivity of cancers, and I think that younger and younger people are being diagnosed with cancer at much higher levels than before. I mean, cancer has always existed in children and in young people, but not at the rate that we are seeing now.
And as aggressive as they are.
And as aggressive, yes. And for instance, we used to see cancer of the pancreas, which is one of the most aggressive cancers, maybe once, twice a year. Now it's 2 or 3 times a month
Oh
that we
my,
get patients with cancer of the pancreas and many other cancers, stomach cancer, the really aggressive cancers, the incidence is rising tremendously.
are you having the same sort of success with these really aggressive turbo cancers as what you've had in the past? Because I know your successes have been really good, that you have in the past with what I would call normal cancers.
They are more and more difficult to treat. And
Mm.
so with many of the patients, the progression of cancer was expected, not so fast. And so we had more time to address their diseases. Now the windows of opportunity are much, much shorter. So we have to be within the alternative realm more aggressive in how we treat this quote unquote turbo cancers. So they give us less time. It's a race, that we have against the cancer. And when the patient comes to us, the patients are cancerous patients is way ahead of us. So we have to put stumbling blocks to level the playing field. And what do I mean by that? Once we level the playing field, then we can do only natural therapies. Uh, but now we have to use, in more cases, aggressive therapies like chemo or radiation to give us time to level that playing field. So yes, they're more complicated to treat, and the outcomes are not as good as with the natural cancers before they were aggressively changed by I know that there is no causal evidence yet, but there's a relationship that's very clear that the only thing that changed was the vaccines. And
Exactly. You know, you mentioned in your book that the art and science of undermining cancer. You mentioned that cancer cells can become resistant to chemotherapy, and they can also become resistant to natural therapies. How does that work?
cancer cells are very resilient and very intelligent. And the way they do this is they recruit regulating elements of the immune system to hide themselves from the immune system. And so they blindfold the immune system and they're there ready to attack, but they don't see the malignant cells because the tumors shield themselves with elements of the immune system designed to regulate the immune system. So one of the therapies that we have, which has given us very good results, is removing this blindfold by exposing the tumor to the immune system. And so our impact protocol, impact stands for uh, immune, autologous, impact, personalized cell therapy, impact. And so with these therapies, and it's a combination of therapies based on dendritic cells that are going to remove those elements of the immune system that are regulating so that the immune system can attack. And since we've been using these impact protocol, our results have improved significantly.
Wow.
And so there's a tremendous amount of research behind these therapies, and newer therapies are coming up. The most studied now are CAR T cells, and they're also based on these type of therapies. So we have been working diligently on these therapies to improve our results, and especially since the advent of these turbo cancers, we are using more and more impact protocols to help these patients with very aggressive malignancies.
Well, we've been talking around the edges here a little bit about your center. So let's go directly to talk about the Oasis of Hope. I know that you are right across the border from San Diego there in Tijuana. And there are well, I can't say a zillion, but there are quite a few centers, across
Yes.
the border there. There's, that are around. And I mentioned to you that I had spent time at Sonavive for a couple of years, that are in Mexico. What sets Oasis of Hope apart from the others? So if someone was looking for a cancer center that they wanted to go to Mexico to be able to get these aggressive dendritic cell type cancers, what sets the Oasis of Hope apart of why they should pick your center?
Several things. I think the first one is experience. We've been, here over 60 years, so we've proven that our therapies are effective. Secondly, most of those clinics are from alumni of the Oasis of Hope. And so I feel proud that, they're doing things that I believe that are correctly done. And I think that we're the only ones where oncologists actually work in treating cancer patients. Most of the other centers are doctors that were either trained by us or by other doctors, but they're not formally oncologists. And I think that deters them from understanding the whole world of cancer. I continuously and other of our oncologists are in all of the world cancer meets so that we know everything that's rising up in the conventional as well as the non-conventional realm. I just came back from an immunological congress in Germany where I was flabbergasted to hear that they're worried now about the flora in the colon. That was like, what? These guys are coming up, and now they're working with diet to improve the possibility of immune therapies to work, the conventional ones. So I think that sets us apart tremendously in the way we can help our cancer patients by having these doctors work with us. And the other one I believe is that we treat our patients holistically, not only their bodies, but we believe that when we provide our patients with emotional and spiritual support, the outcomes are much better. And so I believe that these are the things that separate us from the rest of the competition.
How many doctors work at your center and how many beds do you have?
So we have about 60 beds overall, but the hospital treats other diseases as well. 23 or 24 are specifically for cancer patients. And on the cancer area, we have about 11 doctors working at the Oasis of Hope.
Wow. And I didn't realize that your center was that large. What other types of diseases do you treat there?
Well, we have treatments for other chronic ailments, and we are developing now vaccines for Lyme's disease, for instance. We treat autoimmune diseases as well, and just let's say general surgery, and We had a large group with bariatric surgery also working with us. So it's a full-fledged hospital, and part of the hospital of the Oasis Hospital is the oncological center.
You over the years, the Oasis of Hope Hospital has reported survival rates 3 times higher than in many of the treatment centers or standard American hospitals. Why is this still ignored, particularly in America? Is it really, really the bottom line all about the money?
No, I don't think so. Well, lastly, everything is about the money. But what happens is that in order for you to get something approved by the FDA, or in Mexico as well, you have to prove that it's safe and effective, correct? And to date, the average cost in America to prove to the FDA that your product is safe and effective is about $1 billion.
Oh, wow.
And not every drug is approved. So the amount of money that they spend on this type of research is enormous. And the way that the government compensates the industry is with the awarding them with patents. And a patent makes you a monopoly owner of your invention for a number of years, usually about 20 years. And the purpose of that is for you to make that money back. It just makes sense. But when you come up with a natural substance, the FDA requires you to prove to them that your product is safe and effective. So you have to spend $1 billion. But then when you ask for a patent, they said, we cannot give you a patent because it's a natural thing. So nothing has ever been approved that is natural because of that system, not because it doesn't work. And the misconception of doctors, but especially patients, is that something that is not FDA approved is not good.
Yeah.
And I remember a discussion that I had with a doctor about natural therapies, and he was very mad that we were using non-approved FDA methods. As I say, well, do you think that when something is not approved by it is bad? Yes, he said. So I asked him, do you eat bananas? And he got very mad because bananas are not approved by the FDA. So I said, you see, it's only the FDA says that it went through the process, but something can be very good without going through the process. And so we use many of those elements that have tremendous scientific background at the level of laboratory and animals sometimes, but no clinical trials. But that doesn't mean that they're not good.
Exactly. Very good.
And so we have been able to use, for instance, high dose vitamin C is extremely effective in killing cancer patients, cancer tumors, without damaging any of the good tissue or the normal tissue. And the mode of action of high dose vitamin C is the same as radiation therapy, exactly the same. But
Wow.
they can't use it because it's not FDA approved.
And there's a lot of things like flesh-eating bacteria and, that are really aggressive that it's curative for. But instead, in America, they'd as soon, cut off your body part than to get it treated with high-dose vitamin C. I think that, and you alluded to this earlier in the first part of our conversation about how that cancer does not have to be a death sentence, but I think when most people hear the word cancer, they are so embraced with fear that the first thing they do is whatever the doctor tells them, and what the doctor knows is surgery, radiation, and chemotherapy. They really don't know, like, stop eating sugar and change your diet. And they become so burned out and their immune system becomes so burned out and exhausted that by the time they come to your center or a place that could treat them holistically, there's like not much to work with because they've already been so
Yes.
poisoned with therapy. What would you advise a patient who just, if they just got walked out of the clinic and they were just told that they had cancer? What would be your advice to them before to try to not get so enveloped with that fear?
Well, that's specifically and importantly why I wrote the book, The Science and Art of Undermining Cancer, is to provide them with information that will open up the fan of opportunities and possibilities that patients have. Because when they come to us virgin to treatment, our results are so much better. For instance, we did a prospective clinical trial with stage 4 breast cancer patients. In the patients that had chemotherapy and radiation before coming to us, our 5-year survival rates were 3 times better than with conventional therapy. And these are for patients that were virtually sent home to die
Wow.
that came to us. Now, with the patients that came to us virgin to treatment, the 5-year survival rate is 5 times higher than with conventional therapy alone. So now there are some tumors where chemotherapy shines, and we're going to use it. For instance, the cure rate of most lymphomas is about 95% with chemotherapy. Why shouldn't we use it? Now, the difference at the Oasis is that we're going to be doing, while we're doing the chemotherapy, many things to prevent the side effects, to reduce the collateral damage of chemotherapy. And so we get the cures with patients that didn't have to suffer all of the onslaught that chemotherapy has on them. So again, that's why information is so important, and this is what I provide for people in my book.
So, Dr. Contreras, we've got about 1 minute left. Tell people how they can get hold of your Oasis of Hope, and people can find your book, The Art of Science of Undermining Cancer, in our bookstore at bookstore.drtenpenny.com. But how can they get an appointment or a consultation at the Oasis of Hope?
So it's very easy. Please visit our website. It's oasisofhope.com. Oasisofhope.com. You will get all the information. And we provide a free of charge consultation by myself or any one of our doctors, where we will evaluate your case and let you know if you're a good fit or candidate for our therapy, or if we believe that other therapies would be the best for you. For instance, in cases of lymphomas, where we believe that chemotherapy is the best treatment for you. So we'll be very open in giving you information. So what we require is that you give us a biopsy report, imaging that you had, the type of therapies that you had, so that we can advise you better on what to do next. Oasisofhope.com.
Here we go, oasisofhope.com. And the book, The Art and Science of Undermining Cancer, you can get that probably off of your website, and you can also get it from us at bookstore.drtenpenny.com. Well, we're out of time for today. We could have talked on for hours about all this, I'm quite sure. So I want to thank you so much, Dr. Contreras, for being with us today. I want to thank all the listeners who've been with us here today and who've going to listen to this in the future. And we'll see you tomorrow or the next time right here on the Tenpenny Files. Goodbye, everybody. Goodbye, and God bless.
Thank you.